We left Vancouver in 2014 to move to the United States, and all the time we were in the States, we always spoke so proudly of the Canadian healthcare system. And we had, lots of American friends who would ask these pretty ridiculous questions about socialized medicine. And we'd always say, well, it works really well. And then last year we moved to the island, very excited to be here. But right away, it's like, oh, we've moved to a community of 100,000 people, and over 30% of the folks here do not have a family doctor. And as I've gotten into the job as the CEO of the Hospital Foundation, which is our whole focus is improving healthcare in central Vancouver Island, it's been a real eye-opener. And I'll go visit somebody in the tower. I remember seeing someone on the 5th floor, and the paint is peeling off the walls, and there's 4 people in a room, and the hallways are jammed, and it's just outrageous. I mean, it's a 1963 hospital. If you have chemo, you might have to drive to Victoria every day for 40 days. How does anyone do that? And yet, that's just standard practice here. You have to go south of the Malahat for a lot of things that people need. So this is like this perfect storm of things coming together. And that's really an eye-opener for me and for my family. We believe really strongly at the foundation that yes, we're here to raise money, but we're also here to help give the community a voice, and that's why we appreciate the effort of the Regional Hospital District to bring all the players together, and for all of us in this community to stand shoulder to shoulder and really stand up and say we demand better healthcare in this community. The fact that we don't have a heart catheterization lab, the fact that we have this old hospital that at any given day is running 20% over capacity, while struggling to even just be fully staffed for the base level of 348 beds. And if you have a heart incident, the Canadian standard is, they call it door to needle in 90 minutes. We don't have that in Nanaimo, let alone Qualicum, let alone Campbell River, let alone Tofino. So we need to create, I like to call it a healthcare ecosystem. We need to see this portion of Vancouver Island as a really vital part of the whole healthcare mosaic for Vancouver Island. Advocacy is incredibly important, and that's why we really appreciate what the Regional Hospital District is doing, because we want this to be on everyone's lips. We want this to be the Sunday night dinner conversation. We want this to be talked about when families are gathering. What does it mean to not have all of the aspects that we should have in tertiary care in a major hospital? As we've been starting to lean into this work, we've got City Council shoulder to shoulder with the Sinamic First Nation, shoulder to shoulder with the Medical Staff Association, with the Foundation, with the Regional Hospital District. And we've proven that with the new intensive care unit. So the community, over 5,000 donors, gave $5.5 million to equip the intensive care unit, which is now up and running and absolutely maxed. It's amazing. And now we're doing the same for the high acuity unit. And there was this wonderful couple recently, and he has had a lot of health challenges throughout his life. And for a lot of the issues, he has to go to Victoria. And there was a fear because his partner, his wife, fears she will not be able to drive much longer. And how is her husband going to get to South Island to get the care they need? And they're like, when is the cancer center opening? When is that happening? And we're really excited that there will be a new cancer center. And I was talking recently with a very involved volunteer. She had driven her brother-in-law every day to Victoria for radiation for 40 days. And he recently passed. And her question was, what if we'd had that care here? Would he have been diagnosed sooner? Would he have gotten better treatment? What would that look like? And that really hits you hard when you hear these stories. And so when I hear people telling me these stories of someone who's passed, you just think, well, what if? What could we have done, and how can we do it better? And as Canadians, this is part of our pact of our society, is that we have a certain standard of healthcare, and we're not at that level. And that affects every family and every person living here.